Thank you. We're going to be a bit of a tag team this morning. And yeah, the lighting is interesting when you're of a certain height. Is it? Thank you to the previous speakers as well. I think I heard a lot of interesting information presented in a really interesting way, and I've learnt a lot already just from being here for half a day, so I think it's great. I really liked also the focus on client engagement, which is a bit about what we're going to be talking about. Just to mention, the Australian Centre for Child Protection, as has been said, is a national research centre. We're based at the University of South Australia, but we are independent as we're nationally focused, and like probably a lot of you, we rely on funding by applying for grants and tendering and winning some and losing others. We don't get support. We did for the first 10 years of our existence, but we no longer do. So like you, we're in an environment with shrinking resources. However, it's great to be here and talk with colleagues with similar focus. Our focus is not particularly on young people, but in a way it's related because we're talking today about working with parents who are adult clients of alcohol and drug services and working with them about their parenting. Okay. So the centre, as I'll shorthand call it, in 2009, which is a while ago now, we were interested in trying to broaden the scope of what we call adult-focused services and their approach to preventing the harms to the children of their clients. So early intervention prevention approach, but indirectly through adult-focused services whose clients are an adult, some of whom are going to be parents. So what we did was we funded the National Centre for Education and Training and Addiction to do a survey of alcohol and drug workers about their work with the families of their clients. They had responses from 271 workers. The AOD workers, our nurses, our social workers, a range of other backgrounds from around Australia. And that told us that nearly all of them knew whether those adults that they worked with were parents. 60% of the respondents estimated that between 25% and 75% of their clients had parenting/caring responsibilities. More than 75% of the workers thought that up to 50% of their clients had children receiving child welfare services. So significant end of the spectrum about children's harm, shall we say. So why is family-sensitive practice important? Find the right page. Sorry. I guess because, as I've mentioned, that practice in what we're calling adult-focused services is traditionally focused on the presenting client, the adult, and their problem issue, alcohol and other drug misuse, for example. So here we're talking about child and family-sensitive practice being in those services, working with those adults, but supporting them in their parenting roles while doing that with the intention of supporting their children, tending to the needs of the children. So it's a client engagement approach, as was mentioned by the keynote speaker. You know, having a conversation with somebody about something meaningful to them in their lives can have a very positive effect on them or on people they care about. So this sort of practice occurs in the context of service provision, where the primary role of the practitioners is to respond to a presenting adult with the problem. But having an understanding of adults' responsibility and the needs of their children is valuable in that relationship, because exploring parenting issues can enhance the support offered to them and result in, for the adult, an increase in the motivation to access help. It can result in a more open and honest relationship between the person who's seeking assistance and the worker, and an increase in their sense of hope that change is possible. They can demonstrate change about how they're not or limiting the effects of their problem on their children by working together. And they increase their focus on the reasons for seeking help beyond themselves. It is themselves as a parent, but it's also their children. So I'm doing this for me so that I can be a better parent and improve my parenting. And I guess we all know that parenting is both a significant motivator for change and a major stressor. So it's acknowledging the reality of those things, not ignoring the individual adult's problems, but not ignoring that those problems can have an effect not just limited to themselves, but to their children. We think that exploring the parenting issues with these adults can benefit children by being able to identify any potential problems early, bringing it up as a normal part of their interactions and conversation. It can also help by linking with appropriate support services, and we think that focusing on those preventative strategies early in your conversations or in the conversations with these adults means that families may be able to be diverted from the child protection system, which is what we want to do wherever possible. Unfortunately, they may be called child protection, as our centre is as well, but really we know and we have evidence that if you're caught up as a family or as a child in the child protection systems, you often suffer other harms. It might protect you from something, but it might also mean you suffer in other ways. So you may be familiar with the national framework, as we call it shorthand. And we're saying within that, that's everyone's business. Protecting children is everyone's business. So obviously why the centre that we work for went to the National Centre for Addiction and Training about Addiction, Education and Training about Addiction, was because it was working with another national centre that focuses in a different area. We're collaborating to see what we can find out and how we can work better and more effectively together to prevent harms to children and to not do that in a way that stops the families from getting the help they need or the adults getting the help they need, but by opening up the conversation about what can be done and how can we do it better that will prevent people harming their children, prevent families from being involved in the child protection system. My colleague is going to talk a little bit about some of the research findings and background, and I'll let her take the stage.
Thanks, Christine. Well, I'm not really going to talk about research because I think this is not really that kind of forum, but really our message is quite simple. We've only got a little bit of time today and really just wanted to say that you as adult workers in adult focused services, as we use the jargon to describe you, really have the potential to shape children's lives, indirectly. This conference is about unleashing potential. It's entitled that, but, to us, I guess, our work is about vulnerable children. So, I would say that we would say that you have the potential to unleash the potential of children's lives as well. That working in a child and family focused or sensitive way may not be rocket science after all. It might just be the matter of having, knowing about some tools, knowing about some, having a few questions in your repertoire, so that, you know, maybe that if we could have an outcome from today, it would be that knowing where you could go to learn more, or also to just take away some of the anxiety around asking questions about parenting. So yes, so why are we interested in vulnerable children in this space? Why have we come here to talk to you? Really because we know that some 13% of kids under 12 at least have one parent at least has significant substance use issue. That we know that for our families, we call them, the families that are involved with the child protection system, between 40 and 80% of those families have significant substance issues, or that's a main principal factor for them presenting or being involved in child protection. We know that once kids are removed into care, where there's an alcohol or substance issue, particularly an alcohol issue where we've got more information, we know that they're removed into care younger, they stay in care longer. In care means foster care or residential care, or most usually foster care. They stay there longer, they tend to be less probability they'll go home to their families. And for kids that I'm particularly interested in, that's young people who've been, who have the FASD or, you know, have been exposed to alcohol prenatally. You know, they've got basically the perfect storm of risk factors. You know, they might be removed into care earlier. The parents might not have the support to provide the structure that they need because of the behavioural issues and the learning and attention issues that they might have. And so there's a real perfect storm of risk factors for these kids. So that's a long-winded way of saying that, you know, you have an opportunity as adult workers just to value add to children's lives. And that it needn't be, you know, particularly complex or in-depth work. In fact, I think the literature is pretty good in showing that by doing your business as usual work, you are contributing to children's lives. What we're talking about is value adding. So what the presentation this morning talked about, even those little additional conversations can add exponentially, or that's not quite the right word, but, you know, add significantly to children's lives. Just to highlight, we wanted to quickly show you an example of how these kind of questions can be addressed. Just to mention before, would you like to say something about this resource?
Yeah. Here, COP-ME, you may be familiar with COP-ME, Children of Parents with a Mental Illness. Again, as another national initiative, we've worked together with them, and they have, with us and with other people, have made a number of resources, e-learning resources that are available free online. And of course, our ones that we've done with them are fantastic. All the others are really good too. But certainly, child-aware practice is one. Child-aware supervision is another. There's many others. But I urge you to tell people, if you don't already, about the availability of these free e-learning resources. They're fantastic conversation starters within groups at work. Groups of staff can talk about what they are exposed to together, use it in that sort of team-building way, learning together way, changes organisations by bringing it up in those kind of ways, or individuals can go through the module themselves and do it in their own time. It's fantastic. There's fantastic materials. There's really useful resources. It's free of charge and it's available online. We've got a little excerpt of one of the aspects of it. And we just have to get down. You just have to make this go up. Yeah, That's it. Yeah. We're just to show you a couple of minutes of one of the bits on it. But this is workbooks that they produce that go with them, with all the modules as well.
You've mentioned that Grace is usually quiet in the mornings,
Can we hear that?
even when things are stressful.
He did it so many times.
I'm wondering what that must be like for her.
He's turned it down
Peaceful,
again.
I'd say.
Do you want me to go and get...
We did have the guy in here fixing it before,
Okay, that's all right.
but where can we go to get the
I'll go
volume?
back, and while he comes
Right.
back and fix it...
So the module is just an example. I'll keep doing the salesperson talk. The module is an example of one of the aspects in these e-learning sessions is that they have attached workbooks, so you can go through it at your own pace. There's snippets of people speaking, famous researchers and other persons. There's snippets of people's actors portraying stories, and they are, little bits and ask questions. It goes through questions about this person's life, what could have happened, how could you have dealt with them. Various approaches there. They're really discussion starters. There's lots of topics, list the key elements of things that you've seen. What does this make you think about after listening to her story, etc., etc. Should be
Shall I
okay.
try it again?
We'll try it again.
Nice work.
Try it again.
Oh,
Yeah, nearly.
I can't see what I'm doing without my glasses. No. Oh my gosh, you do it.
Okay, go back. Okay.
I can't see with that.
Lift the thing. How do I lift it up? No.
Oh, I can't do it. Wait, there we go. It's coming, it's coming.
It's very touchy.
It's super, super sensitive. Yeah. See, it just doesn't come. Yeah, we.
How you'd get it there?
That's all right, because he's not under pressure.
Cross fingers.
And you've mentioned that Grace is usually quiet in the mornings, even when things are stressful. I'm wondering what that must be like for her.
Peaceful, I'd say. She's not getting involved in the brawl. She's just getting on with it. She's getting things done, helping out.
You've said she helps Tom. Does she help anyone else? Sally, you?
Mostly Sally and Tom. She does get my coffee, though.
Does she help out because you or Sally ask her to, or does she do it off her own bat?
She usually gets things done without being asked. She's just a bit older. She's thinking ahead. She's good like that. She probably knows too that she'll get to school on time if she does.
I'm wondering what that must be like for her. Stressful mornings, being everyone's helper and doing her own thing. It's quite a lot of responsibility for a 13-year-old.
She's not complaining or anything like that. If anything, she seems to be going through completely unscathed.
Sometimes in families where there's stress and tension, children can react in different ways.
But Grace isn't reacting. She's doing it sweet.
Some kids react by trying to make the tension go away, so they try to smooth over the tensions by helping out or not causing any fuss. Has she talked about the mornings and how she feels about them?
No, she hasn't talked to me. She mostly talks to her mother. They're very close.
Has Sally mentioned anything about Grace?
Sally mentions everything. So, yeah, she says the kid isn't happy, but that's just to get at me. I'm telling you, you don't know what she's like. Any chance she gets to make me feel like a bastard, she's in there.
So that's an example of one of the videos from the COPME resource. So you can see you could work through this material yourself online, or you could do it as a staff training or a conversation. There's some guided questions that go along with that in the workbook. So there's some really good material that you can use as a reflective conversation. Christine in particular and some of our former colleagues have done a lot of training around Australia working with adult focused services and about bringing the child into the room, like making the child visible or bringing the child's presence into the room. And some of the things that people talk about that helps on an individual worker level, and some of those things include like having a set of questions, and this resource can help you to develop those sorts of things, being able to develop reflective questions, having a stance of being able to co-align with the child and the parent at the same time, reframing kids' behaviour. Often behaviour is a source of stress for the parents or for the adult in the room, so being able to reframe it as a coping mechanism. And some of the things that we bring into that conversation that have been highlighted in Christine's training around Australia are things like the belief that it's really not our role to have those conversations, the belief that if we go there, then we're going to end up with a child protection notification, we're going to damage the relationship, and some of the difficult personality issues. So for some clients, there's perception that, you can't actually get them to engage in a conversation, putting themselves in the child's perspective, because they're just not naturally a person that can do that very easily. So these resources can help a reflection around those facilitators and hindrances around having child and family sensitive conversations and bringing the child's voice into the room in a virtual way. There's also resources from NCETA, have got a training manual, and Odyssey House have developed training program as well, and there's probably others that you may be aware of as well. How are we going for time? All right. Yep. Yes, and so basically, Christine, if you want to comment about these as we go through, because Christine's done most of the training on working with adult services and community for children sites, if you want to talk about that. Basically, what people talk about being helpful is really focusing on the client as a parent, focusing on the child as being both a source of stress, and people are usually quite comfortable to talk about that, but it's also a powerful motivator. What parents' hopes and dreams for children for having a different life than they have at the moment, or that the different life than perhaps that adult client might have had, is a really powerful motivation tool, and I'm sure you've all experienced that. Increasingly, there's a move in services, it seems to be, both in child welfare services but also in adult-focused services, I think, towards this sort of general specialist kind of thing. So when we talk to child protection and child welfare services, or child-focused services, they also have an anxiety around dealing with adult issues that impact on children. So there's increasingly recognition that we all have to be kind of good at everything, or at least to the level of recognising and being able to refer on, to be able to recognise that there's, or ask about, for a child protection worker or a child welfare worker, to be able to recognise and ask about drug and alcohol issues or mental health issues. And that might seem obvious to you, but for them it's really can be quite a challenging conversation. So I imagine it's may be the other way around for you guys. So there's a move to recognise that we all have to be skilled up across the board. And when we look at the literature around effective child and family interventions, no matter what program you're looking at, the common components are this kind of idea of trying to increase parental reflective function, so their ability to put themselves in their child's shoes, what that must be like for a child, those kind of questions that guy was asking on the video there. Yep. And also the connections to social networks, a really important protective factor for kids. Positive social networks, I mean. Helpful social networks. And if you as an organisation or a group decide, are you going to decide to skill up in this area or develop your thinking or your reflection, or, what do you want to do in this space? What are some of the ideas that people have had when you've done the training? Yeah. It's been around asking people at intake, are they actually parents? It's been about developing a checklist around family violence, and then, well, if there is an issue of family violence, how are you going to deal with parenting, or are you going to refer that on? So having a little bit more of a systematic approach, people find, was one of the things that's come out of the workshops, developing up a bit more of a systematic approach and thinking around parenting. Developing links to child and family services, really working hard as a result of that, those trainings that Christine's done, around developing up your relationships, because often you're working with very complex families. You can't have all that knowledge, so how can you leverage your relationships to support these families? And that's basically saying the same thing. How flexible is your funding model, or how flexible are you in service delivery? Is there anything you could change around that? Around appointment? Beg your pardon? Yeah, those. And these are some of the things that people have looked at. Changing parameters around appointment times, transport, childcare. Did you want to say anything about that?
Yeah, and people talk about child-friendly spaces. So that's a good thing. What people mean often is just some toys in the corner, which is not necessarily as child-friendly as if the children are hungry, then maybe some toast and something available to eat. It depends on the sort of service users that you're working with and what environment one is in, what's useful. So you need to ask the people who's about their children. Do you know if they've got 3? Do you know if any of them are sick? Are they struggling at school? Have they got no friends? If you display an interest in the children, you're going to ask next time you see them, how's he going with that issue that we talked about before? They become real. You're talking about real children. They're really important in the lives of the people with the alcohol or drug problems. So it's really, in a way, it's not at all rocket science. It's a lot more about engagement. And ways that you engage with people about all their life, not just focused on the problem area, I guess is the major issue, and the ways that one can go about it. A little snippet showed a fellow attempting to get the father, who is the one with the alcohol problem, to consider that his daughter was possibly dealing with the issues that she was facing in a way that he hadn't interpreted as having any effect on her. Just trying to point that out to him, that his alcohol problems has an effect on the 13-year-old. Just because she's quiet, it's not meaning that she's not getting affected by it. So basically, we are just saying to you, there's a lot of resources out there, but the main point of trying to be involved more broadly about children who are impacted by the problems that parents have is to prevent the harm going over generations, prevent the harm of it escalating, and address the human side, the parent side of the clients that have the drug and alcohol problem together as something that you can work on in a positive way together. A lot of material resources. COPME website, I urge you to have a look at it, use what's available, and thank you for listening.